All right, I think we're ready, Will.
Yeah, glad it's 2 weeks after I finally figured this out, so it's good.
It takes a CIO like weeks to get video conferencing, right? Look at your conference room. I bet you we all have problems with conference rooms.
Yeah, I won't tell you how long it took me to figure out how to install a local printer on a Windows device yesterday.
So now we're starting to appreciate how hard these audio visual is. All right, good stuff. Well, let's get started. We got Will Walders. Most important thing, quick intro about yourself. What are you
Yeah,
doing? And then I want to hear what are you drinking? That's the most important thing.
well, I don't know if it's most important, but yeah, it's certainly important. Oh yeah, so William Walders, Chief Information Officer at Health First. We're a $2 billion integrated delivery network on the east coast of Florida. So full IDN health plan, so payer provider. We've got outpatient wellness with home care, a bunch of other lines of business, our own MSO, managed service organization with our own docs. 4 hospitals are about 1,000 beds in aggregate. And then, what am I missing? Oh, the health plan, I mentioned 160,000 covered lives. And yeah, that's it, all 4 branches. So what's going on in our world? I think we're all talking about COVID right now. A lot going on there. I'm sure we'll cover some of that. And as a result of that, it gives us the luxury of sitting here having something nice to drink. I definitely want to thank the folks out there on the front lines, all the people we support from an IT perspective, providers, doctors, nurses, ancillary services, you name it. Those folks right now are really doing the hard work as we get the opportunity to sit here and chat about how we enable them and have some nice stuff to drink. So for me tonight, I think 2 weeks ago I had a nice bottle of red wine. I think I finished it that night, which I'm not proud of. Um, Tonight, this is more up my alley. I actually made a Sazerac, which is one of my favorite drinks, with the Redemption Rye 9-year-old version. It's kind of my daily drinker right now since I've got a lot to go through between my birthday passing last week and a couple other things, adding some stuff to my inventory. So that's what I got. What do you got, David?
I went with the Japanese whiskey, Centauri. This is sort of my daily go-to if I had to drink something nice and easy, smoother. But yeah, it's also one of these Costco specials. Somehow I just saw my local Costco came stacked up with tons of them, so I bought about 3 of these bottles.
Yeah, that's good whiskey. I'll tell you. Had the luxury to have some a couple Christmases ago when I was in Boston. One of the local folks were raffling off one. Had the opportunity to buy one, not necessarily win one, and it was very good. Went through it quickly.
Yeah, I remember this is a funny story about before the Yamazaki craze. Right, these are the Japanese whiskeys that were everywhere. I mean, duty free airport, I was able to just pick them up for like $50, and then we went like $60, $70. I mean, 18-year-old Yamazaki. Now I'm sure they're in the few hundreds. Can't find them anymore. And when I was drinking those like they were just regular whiskey, like what I'm doing right now, a
I know.
daily
I'm waiting
drinker.
to do this. I've got a nice bottle of a Whistle Pig, 12-year-old variant that I'm anxious to get to. I just don't want to have more than one bottle open. I decant it. So
So what you
it's
got?
just me, right?
Yeah,
It's
yeah, yeah.
get through it.
I know. All right, so I mean, obviously a month into it, everyone's. Are you feeling this command center Groundhog Day yet? I hear from a lot of our friends who are just, they're like, man, this is Groundhog Day. Other organizations, actually in the South, in the Florida area, Miami, and IT staff working like 7 days a week. I mean, which is why the frontline folks, they're putting in a lot of work, and even executives, right? They're putting in a lot of work now. Some are taking pay cuts just to be able to stay afloat and be able to support other resources. Are you guys feeling the Groundhog Day yet?
Yeah, yes to all those things. So we've a couple things. Um, we broke off into 3 teams, right? So we have the command center, the day-to-day operations. We have the surge team, largely physician and clinically driven. I'm planning for the worst case scenario. And the third team, one I participate on, is the sustainment team, or the post COVID type planning for what that looks like, and kind of returning to normal operations. Our CEO learned some lessons from the Northeast and has stratified those teams. We're not even allowed to be in the same room or overlap in facilities. And in fact, you can't go to a clinical facility and be on one of those 3 teams. So my CTO and chief operating officer are alternating the command center duties. And I forced them to take days off. Actually, CTO just took his first day off since this started yesterday. And I told him if I sent him a text message and it said delivered, that I would fire him. I
Oh, that's
want your
great.
phone I want you to check out. Don't look at anything. And he did, apparently, because I never saw anything from him yesterday. And the weekend, I gave my, in essence, it's a COO of IT, but our lead for operations, a CTO peer, the entire weekend off. And the same criteria applied. So, but yeah, every day, 3 calls a day, just the normal status stuff. Subcommittees for the post-COVID reinstatement phase. We got a lot of planning there. We've got 4 committees doing kind of what surgery is going to look like. We're going to staff our ORs, 24 hours a day if demand indicates that. We're expecting somewhere around 125% of demand, and we'll be open on Saturdays. Same with diagnostic radiology, cath lab, and then a couple fun ones. One of which I chair is what this looks like after from a telehealth perspective. We've gained all this traction. We were averaging, I just looked at the numbers today, as sad as this is about to sound, 20 telehealth visits a week prior to COVID. We are now at 1,000 a day. So how do we make sure that scales and sustainable? And then another from work from home, like Workplace 2.0 is kind of what I'm trying to buzz it. And that's hopefully what sticks. But what do we do now with folks working from home? We were talking about building other buildings, to house some of these administrative folks. And growing about 15% in IT, and I don't have places for them. And we've been pretty creative around that. So how do we codify and formalize what this looks like from here on out?
Yeah, no, definitely. I think people are starting to thinking about post-COVID, which is good. I think we have to start planning for that. Obviously, the remote workforce, telemedicine. That's probably where all of the investments are going to be, if I had to bet. What about ERP for you guys? Were you guys ever in an ERP discussion where you're looking to upgrade like the other organizations, or starting to get feelers out there? Is that on pause? Is that still continuing?
Yeah. No, it's on pause at the moment. In fact, I just paused it last Friday. We had a huddle every Friday between that and CRM as to what direction we're going, aggregating requirements. Some lines, so I just mentioned, we're 4 unique lines of business aggregated as one thing, Health First Inc. And on the health plan side, we were ready. We had all the requirements, everything was detailed. Wasn't quite as mature in the other places, and then this happened, and it really just tipped the scale. We're like, yeah, let's take a knee. Let's make sure we've got everything lined up, I's are dotted, T's are crossed. But we hope to, by the end of this fiscal year for us, it's the end of September, if not the early next year, to have that kicked off again and put it out for RFP.
Yeah, I think that's pretty consistent with a lot of organizations. They're all focusing on now integrating all these telemedicine platform, all these devices. It's getting a little bit more real now. So I know the telemedicine stimulus bill is out. Lots of folks are starting to apply for it. I read somewhere now, I believe, correct me, Ron, I know you went through the entire document after I shared it with you. There was something in the notes about at maximum $1 million per facility. That's the max that each organization would receive. So let's just take the maximum, about possibly 200 organizations will be vying for the grant, if not more, then they would be receiving it. But now they have all these intake of stuff. I mean, are you guys in that same situation where you're going to have a telemedicine platform? You may have wearable companies that's going to be part of it. I mean, what else? Are you guys in that same situation?
Yeah, we are. I mean, we're not down the wearable path. If you look, this grant existed pre-COVID for things like that in rural health settings, the connected health aspect. And you see, small grants, 40, 50K for Apple Watches and CHF scales and glucometers in the home. And the intent was to grow to, some underrepresented communities, rural, veterans, low socioeconomic folks. What the CARES Act has done is ingest that $200 million into all things telehealth. So we're more down the path of, all things, just those things. I'm not going to endorse any companies that we're negotiating with at the moment for this, but think about hospital in the home, think about normal telehealth, aggregating all those things. Think about chatbots and AI, proper triaging of those folks, steering them to the right points of care. What else are we looking at the moment? Some cost and price transparency as part of that. Capturing some of our digital initiatives, and frankly, covering the cost of our COVID-related expenses. So I would say about half. We're going roughly for about $1 million, just shy of it, and about half of those are going to be things that we've done around hardware. It's getting hardware to folks who are no longer have to be in a patient room as a result of this, right? So we're building, some really neat things for tele-respiratory unit, if that's a thing, where the nurses can check in on the patient. They don't have to don and doff PPE and waste that, right, as these are already constrained and restricted. So building some things out for that. We restricted visitation, so families cannot visit their loved ones who are sick. So put some tools in the hands of those patients so they can collaborate with their loved ones, collaborate with the nursing staff. So we've gotten really creative around that. So I'm hoping, just to recoup a pretty significant portion, around 400K of our existing hardware spend, and then the rest will be to keep our momentum going, to support existing COVID efforts, and to continue the traction we've made with the COVID response. And that's the scope of that grant is specific to COVID, right? It has to really solve some of the problems and ideally addressing some of those populations. And I think we're the perfect storm for that here in our county. We're a not-for-profit health system, so we immediately qualify it on its face. And from a socioeconomic, veteran population, elderly perspective, we hit all those wickets. So I think our grant, and we'll be putting it in any minute, is very competitive.
Yeah, hopefully you guys get that. I know Health First will be putting that to great use, especially with your leadership, getting the technology, making that a competitive advantage for the organization, and most importantly, serving that community. So it'll be awesome. I'm looking forward to seeing that. So as you just mentioned, all these things are coming together. One thing that I have seen that's missing in the healthcare ecosystem is a platform to integrate this. So are you guys looking at a separate platform? Would you be using an existing platform? I've seen so many various solutions out there, but never been able to gain traction, right? Because healthcare providers have been traditionally tied into their integration engine. We talk about having things that sit on top of it, but no one's really doing it. So in theory, I think people get it, but no one's pulling the trigger just because it's not as proven. That's something you're looking at as well?
We are kind of on the backside of this curve, right? So, we've got what we've got. We've got to optimize it and scale it. I would love the time and ability to do, build this agility layer, this common platform. I joke, you probably heard me say this at Chime. If we all remember the enterprise service buses of like 15 years ago, and I hate using this analogy, but people think you have a book in 15 years. But, imagine plugging all of those components of the disparate EHRs that we have and other tools, even outside the EHR, into a common layer, right? ESB, if what that is. But, the agility layer is what some folks are calling it, or even CRM at a high level. So we are, as I mentioned, we've carved out 4 recovery committees, of which I'm on the virtual health one and telehealth. And that's what that will do. That will build the longitudinal plan. In fact, the business rule I have for that, I'm writing the memo now, kicked off today by our CEO, is pretend we have a green field and we own nothing, right? Like, what does this look like? And that's what we'll be pursuing.
Yeah, no, that's great. It's funny, you said the ESB. I remember I was buying an ESB about 10 years ago when Microsoft had their ESB and we were overseas in Abu Dhabi with the Cleveland Clinic, and that was our integration layer. And people thought we were crazy. They said, "What do you mean? What is this thing? This is not a commercial integration." And just said, "Guys, this is something that acts the same way, except it gives you a lot more flexibility." But what was hard was getting engineers to be able to support it and code it, especially being overseas. They just didn't have the skill set. So now you're throwing a somewhat new philosophy along with technology, and people just thought we were the craziest people trying to utilize ESB. And now it's back in place again. ESB is alive.
Yeah, the pendulum swings back and forth, right? The answer, to some and many today, you only have to look at, in the news recently, some systems converting to these monolithic big EHRs, like this, single everything, single reg, single EHR, single everything. And that's not working. It's not working for anyone, right? Everybody has their own limitations. We've got somebody in our cohort who had the great luxury of literally going to a greenfield hospital and starting from scratch. None of us have that luxury. I'd be curious on where that hospital stands today and the best of breed and kind of everything's hybridized in there. It's just the nature of the game. We did app rationalization, just a discovery phase since I've been here. We have 683 of these things, right? Yeah. 680 applications. And this is after we got by the also known as and the duplicative ones and the ones that are just hanging on by a string. We've sunset a lot to the tune of a pretty significant savings, 7+ figure savings. So these are real 683 things I've got to rationalize into a common platform, or at least look and feel like the same, user experience and customer experience in some cases. So there's a lot of work ahead, and we know where we're going to start. So
yeah, No, definitely. I'll be watching that journey as you guys are implementing some of these cool technologies. All right, lastly, what's your recommendation for your peers going through this situation? You already gave them some great tips as far as forcing staff off. What else are you thinking about that's very different for this team and for your peers?
Yeah, just to be open and transparent. Bad news does not get better with time. Understand your limitations, right? You're not going to be able to change a lot. This is well ahead of all of us. You probably have another 3 to 8 weeks of this being a thing. So you've got to pick your battles at this point. I think most have figured that out, right? So, pull your staff, have fun with them. I do this 3 days a week with my entire staff, right? We're on the webcams. We're doing silly things, dance parties, and mask competitions, and just general goofiness. I mean, just to keep some levity and people understand it. It's your trying times. They look around the country and see people being furloughed and things like that. Thankfully, we have a pretty strong balance sheet at Health First, so it's not been an issue for us. So make it, just stay engaged, right? Be empathetic to the folks who are having issues. Be flexible, and rotate your folks through. You and I were collaborating on a Twitter thread recently. You've got the haves and have-nots, if you will, of time and time off right now in your department. The people on the front lines are getting cycled, right? We call them field service technicians, but kind of your level 1, level 2 help desk technicians. They are getting their butts kicked out there. It's no secret I was in the military. I love the Marine analogy that every Marine's a rifleman. I've been preaching the fact that every IT person's a help desk technician. So it's time to polish those skills. Cycle those folks off the front lines, allow some of those folks who haven't been there in a while to get back there. It gains a lot of relevancy and power, especially from a manager perspective, to remember what the other side looks like. And more importantly, the folks on the front lines respect that and give those folks some time off. Leverage your partners here. I think a lot of us are doing a good job of that. There's a lot of folks out there that are here to help. We've got a list of good guys and bad guys. Good guys, doing all the right things. And I can't imagine right now, but there are a few. I've got somebody hounding me right now. You got 10 days left to pay this renewal, or we're turning it off, right? And you're like, are you kidding me? So vendor management is not lost here. Do something to rationalize those. We built something called the Digital Task Force, and those folks, we meet every day at 4:00. We get all these good ideas, all these free offerings from our vendor partners, queued up through the machine, see if it's real, see if it's something we need. And we've gained speed to market in 3 weeks for some really powerful things. So if you go to hf.org, it's our website, you'll see our symptom checker, but it's bigger than symptom checkers, that you see on the CDC or Intermountain or any of these others. Because if that was the case, I'd just point you there. Like, why build one? It triages you directly into our systems, right? The ability to schedule right there a virtual visit, the ability to talk to a nurse, the ability to do the things. And that was kind of my business rules around that. I shared a virtual visit story. So anyway, have a clearinghouse and form for these opportunities. Now, we were lucky in Florida, in particular our part of Florida. If I was sitting in New York or Detroit or maybe LA right now, I'd laugh at the words I just said. So certainly would be respectful. Those folks are drown proofing right now. But if I could give any advice, it'd be those things.
Yeah, no, that's great. It's funny how this vendor is hounding you for payment. Well, I guess they're blacklisted now. Blacklist is going to be a real thing soon.
Yeah, and we all talk. I got to I'm not kidding. I replied to the gentleman, like, really, like, it's a conversation you want to have in the middle of a global pandemic, right? I was like, please turn it off. Like, let me have that call to your CEO or anyone else. It's just, it's trying times for us all. And that individual, and having been on the sales side briefly, and you work with those folks too, David, in your role from a sales enablement, I get it, right? Their jobs are on the line too. They've got to close those deals, especially the ones that are already in the queue from a renewal perspective. So I totally understand, but this is a company that, you look around your house, you've got your name on their stuff. You own something over there. We've all, they're the platinum sponsors at all these things, or Fortune 100 companies. It's a little frustrating.
Yeah. Well, thanks, Will. There you have it. We got Will Walders. Reach out to him if you have any questions. Thanks, you guys, for tuning in. Thanks, Will.
Oh, yeah. Anytime, David. Had to chat.